All right, everyone, we got about 2 minutes after the hour here, so let's go ahead and get started. So again, good afternoon, everyone. It's good to see a lot of you are already logged on, and I appreciate you being able to take time out of your day to join me here on our webinar. My name is Jeff Kirk, and I'm our Sales and Operations Manager here at Health Matching Account Services. So I'll be taking you through the webinar today and introducing you to our proprietary first-star medical benefit that we have on the market, called the Health Matching Accounts, or HMA for short. So what we'll do on our call today is take you through how the HMA works, show you the benefits that we're able to provide, and the different ways that you can market and sell this to your clients. Okay, so that's what we're going to look at today. And so the reason we have these webinars to introduce the HMA to you is that because this is our proprietary product here at Health Matching Account Services. So this is a product that we did create and design ourselves. It's also trademarked and patent protected. So this is a product that's exclusive to us. Okay, you won't be able to find this through any other company. And because of that, it is a very unique benefit. Okay, there's really nothing else like the HMA anywhere else on the market. Okay, so we like to have these introductory webinars for our licensed agents and brokers that are interested, in order to properly show you how the HMA works and the benefits that it provides. Okay, so what we're going to do that is, what we're going to go through is our website, which is healthmatchingaccounts.com. And we're going to go through a couple of the different pages here that we have available on our website. So this is all public information that we're going to look at. Okay, so you'll have the opportunity, if you want, to come back to our website on your own time to look back through this information, okay? Because again, this is different from any other product that you've ever seen before, okay? So sometimes it takes a couple times of looking at it to really fully understand and appreciate the value that we provide. Also, I am going to be sending out a recap email after the webinar today as well. So I am going to include some of the actual links to the different pages here that we're going to look at. I'm also going to attach our brochure. Okay, so again, just want to make sure everyone understands that I'm going to introduce you to the product today, to our Health Matching account, but you will have the opportunity to go back and look through this information more on your own time. Because again, it does take, a few times of really looking at this to really appreciate the value that we are providing. Okay, alrighty here. So getting started, the way you want to think of the HMA is as the premier first dollar benefit that's now available on the market. Okay, so this is built to be kind of a hybrid or a combination between a regular medical savings account, like an HSA, and a gap insurance product. Okay, so we designed the HMA kind of mixing those two benefits. It's very comprehensive and accumulates like a medical savings account, like an HSA. But that growth mechanism is based on an insurance model. And we're able to award a monthly crediting or monthly benefit based on actuarial science, not from a small financial return. Okay, so that's what we're going to go through, but that's how you want to think of this. Is the HMA is the premier first dollar benefit now on the market, and it works as kind of a hybrid between a regular medical savings account and a gap insurance product. Okay. Okay, so first thing, the HMA, this is an after-tax contribution. Okay, so it's not pre-tax or tax deductible like HSA contributions or health insurance premiums. Okay, so that's the first thing to understand, that this is an after-tax product. This is also not considered to be an insurance product. Okay, so even though as we go through this, I'm going to mention that it's built and designed just like insurance, and we use the same principles of insurance to award our benefits, this is not considered to be an insurance product. Okay, two things to keep in mind. This is an after-tax contribution, and it is not considered to be an insurance product. Okay. Now, because of those things, we have some very unique benefits that we're able to provide with the HMA. Number one is that this is a product that is available for everyone. We don't have any restrictions on who can enroll. Okay, there's no age restrictions. matter what type of health insurance plan they have. This could be sold to both those that have health insurance or on Medicare. It could even be sold as a standalone product. There's also no underwriting. This is guaranteed issue. No one has to prove health. And there's no exclusions. We'll cover all pre-existing conditions as well. Okay, so again, something that's available for everyone. No restrictions on who can enroll. Another key benefit is that the HMA is very comprehensive. Okay, in that regard, it's similar to an HSA, with how comprehensive our benefit is. Now we're gonna take a look at a page here talking about what medical services can be paid for with the HMA medical benefits account. Okay, so it starts with the same list that HSAs cover. I'm going to scroll down here. And that list that HSAs cover is defined by the IRS section code 213D. So if you're familiar with HSAs, you know how comprehensive they are. Okay, it can be used to cover all primary and major medical care, so anything that's going to be a deductible, but also help cover ancillary expenses not covered by health insurance or Medicare. Things like dental, vision, hearing, prescription drug costs. Okay, so here's kind of a list of the most popular items that HSAs cover that we cover as well, okay, with the HMA. But because the HMA is an after-tax contribution, we are also able to cover elective procedures. Things like plastic surgery or cosmetic surgery, LASIK eye surgery, fertility treatments such as IVF, elective dental, things like that. Okay, so a whole other category that we cover that HSAs cannot. HSAs cannot be used to cover elective procedures such as plastic or cosmetic procedures. But we're able to because this is an after-tax product and we're not restricted to what the IRS considers to be a qualified medical expense. Okay, so again, already two very unique benefits that we provide with the HMA. Number one, that this is a product available for everyone. And number two, that we cover elective procedures as well as, of course, all regular medical expenses that HSAs cover. So available for everyone, very comprehensive. But now the real benefit and the real purpose of the HMA is that we've designed it in order to maximize the benefits and the account growth that we're able to award our members. And again, the way we've done that is by designing the HMA using insurance principles. Okay, so again, this is not considered to be insurance, but it is designed and works the same way as insurance, where we're using a risk-pooling strategy and claims experience in order to award a increasing medical benefit. And the result, as the screen pulls up here, is that we're able to award our member account balances approximately $2 worth of benefits for every $1 that they've actually paid in as their account grows over a 36-month schedule. Okay, or simply put another way, our members are able to double their money or approximately double their money as their account builds over a short 35-month schedule. So this is really the main purpose of the HMA, is that we've developed this growth mechanism through actuarial science, not a financial return. That leads to a very significant and rapid buildup. Okay, where again our members can average about a 2-for-1 benefit over 35 months. And use that, of course, to help cover deductibles or their annual max out-of-pocket, save up for a major dental or an elective procedure, cover prescription drug costs, things like that. So we're actually able to award our members this extra medical benefit crediting to offset or help offset future out-of-pocket expenses. Okay, so what we're looking at now is our product option chart. Okay, so whenever our members enroll, they're going to select one of these 11 options. Okay, and the main purpose of each of these different HMA options is that each one is designed to accumulate up to a specific target account balance here on the right-hand side over a 35-month schedule. So what we're doing is we're basically vesting a benefit over 35 months. Okay. So if we look at the first level, the HMA 2500, we call it that because it's designed to accumulate up to that target account balance of $2,500 over 35 months. $5,000 builds up to $5,000. The HMA 10,000 would build up to $10,000. HMA 30,000 would build up to $30,000, all the way up to the HMA 60,000, which would build up to a $60,000 medical benefit. Okay, so when our members enroll, they're going to choose one of these options based on what their needs are. And of course, that focuses on what amount of a first dollar benefit do they need to cover their out-of-pocket costs. Okay, that might line up with whatever their deductible or their annual max out-of-pocket is. Maybe they would want to build up a benefit to cover multiple years of what their deductible is likely to be over the next few years. Maybe they want to save up for something specific like LASIK eye surgery, or save up for IVF treatment, save up for major dental work like implants. A number of different things. And so these different options here, these 11 different options, really can fit into everybody's situation, both medical needs and budget. Okay. Now, when they enroll, they're going to be making a defined monthly contribution here on the second column titled Monthly Cash Contribution. If you want to think of these contributions as being just like insurance premiums, okay, because again, this works on the same design and principles of insurance. So these contributions are much more similar to insurance premiums than cash deposits, okay, because it's a set amount that they're paying every month for the product option that they select. Okay, so if they choose the HMA 2500, they'll be paying in $40 a month. HMA 5000 is $84 a month. The HMA 10,000 would be $140 a month, and so on. Okay, so that's a set payment or contribution they're making every single month. Now, the way their account grows is each month we're also awarding a medical benefit crediting in addition to their contribution. Okay, so they pay in their contribution, and then we're adding an extra crediting to their account balance. Okay, and so that result between their contribution that's being paid in and our extra medical benefit crediting, that's what builds their accounts up to this target account balance. Okay, so if they choose the HMA 2500, they're paying in $40 a month. So over 35 months, that would equal a total contribution of $1,400 to build up to $2,500. So they paid in $1,400. Our crediting would have added the extra $1,100 to give them a $2,500 medical benefit. All right, or another example, if we look at the HMA 10,000, they're contributing $140 a month. So over 35 months, that would equal a total of $4,900 paid in to build up to $10,000. So our crediting would have added that extra $5,100. Okay, so that's the real purpose of the HMA. Okay, but again, all the benefits, the summary so far, the HMA you can offer it to everyone. Okay, again, no restrictions on who can enroll. Number two, it's very comprehensive. And the HMA account balance can be used to pay for all primary and major medical care, also all of the regular ancillary expenses. Again, it starts with the same list that HSAs cover, and in addition to that, it can be used to pay for elective procedures. And then number three is that by designing the HMA using actuarial science, we're able to award this extra medical benefit crediting to their account balance each month. That's designed to accumulate up to that target account balance over a 35-month schedule, resulting in approximately a 2-for-1 benefit. Okay, so again, a lot of advantages of the HMA. As I mentioned at the beginning, this is now the premier first-dollar benefit on the market. There's nothing else that can compete with how comprehensive and how quickly the account grows. Okay, compared to gap insurance products, of course, much more comprehensive. They get much more value out of this compared to gap insurance products. And then, of course, medical savings accounts like HSAs. Of course, there's no comparison because, I mean, we're doubling their money over 35 months, whereas an HSA, which is just a regular cash account, they're only going to have available what they put in. And so we're building up twice the medical benefits that an HSA can do. Okay, so compared to other, deductible type products or first dollar benefits, HMA now provides the premier value. Okay. So that's the introduction here. All right, so now what we're going to move to next is we're going to look at a specific example of the HMA 10,000 to give you a better idea of exactly how that medical benefit accumulates over this 35-month schedule. All right, so go back up to the HMA category at the top, then go down to example of how the HMA account balance grows. Okay, so here, we're looking at the HMA 10,000, represented by this arrow. And this is going to show how we reach this paid-up target account balance of $10,000 over this 35-month schedule. Okay? So it starts back in month 1, and here with the 10,000 plan, the monthly contribution is $140 a month. Now, built into all of our contributions are maintenance fees that we take out to cover our costs, such as paying commissions. Okay? Also in month 1, the crediting that we award in addition to their contribution starts out very low. So the result is between the maintenance fees that are taken out as well as the small crediting in the beginning, what results is that they are actually going to start out with a smaller account balance over the first few months of what they're actually paying in. Okay, but as you'll see, that quickly builds up. So in month 1, when they contribute $140, their actual account balance is going to start out at $110. Okay, then going forward, every month going forward that their account is not used, that crediting percentage increases. So in month 2, when they contribute $140, their account's going to grow by $120. And now they have a balance of $230. In month 3, their account's going to grow by $130, give them a balance of $360. In month 4, their account's going to grow by $140, give them a balance of $500. In month 5, it's going to increase by $150, give them a balance of $650. Okay, so again, as they go forward, every month the account is not used, that increase in crediting is adding an extra $10 of growth. So yes, they start with a smaller account balance over the first few months, but that quickly changes. And if we look at by month 12, first of all, in month 12, assuming they haven't used it yet, their account balance would build or grow by $220. At that point, would have paid in $1,680 to have an available account balance of $1,980. In month 24, their account would grow by $340. At that point, would have paid in $3,360 to have $5,400. And in actual month 35, their account would grow by $490. At that point, would have paid in $4,900 to have that $10,000 paid up benefit. Okay, so of course, as you can see here, it's a graduated benefit. Okay, in the beginning of approximately the first 6 months, they're actually going to have a slightly lower account balance than what's being paid in. But because of that increase in crediting, by the end of year 1, they'll start to see some of those extra medical benefits accumulate, and then most of this benefit builds up on the back half of this 35-month schedule. All right. Now, we designed the HMA benefit this way for several reasons, and we did work with a premier actuarial firm on designing the schedule. And one thing it does is allows the product to be fully community rated. You know, I mentioned no restrictions on who can enroll, including no underwriting. Okay, we're able to do that because, you know, the limited growth and benefits early on act as a built-in waiting period for us. Okay, well, yes, you know, they do have an available account balance, but we're not really at any exposure, okay, because it takes several months at the beginning to start building up those higher benefits. Okay, so again, acts as a built-in waiting period. Okay, for that same reason, that's also how this is very comprehensive. We can cover anything from going to the dentist, primary doctor, a specialist, getting LASIK eye surgery, and inpatient or outpatient surgery, x-rays, MRIs. Again, it's very comprehensive. And really the only medical expenses we do not cover are paying premiums and buying over-the-counter products. Okay, and the key to that is this built-in waiting period up front. All right. And then the third reason for this design is based on claim statistics. Okay, first of all, that's how we're able to award this extra crediting. Okay, because we're using a risk-pooling strategy and awarding this benefit based on claims experience. Okay, and it starts with the same principle or same statistics that regular health insurance uses, which is in any given year, approximately 80% of all claims come from only 20% of the people. Okay, so we're we're using the same concept here. Everyone's paying in their monthly contribution to the HMA, but we can only expect about 20% of our members to have a high claim payout. The other 80% of our members are just likely to have a small claim payout. Okay? But from year to year, the majority of the high claim filers changes. So that 20% is always changing from year to year, those that are high claim filers. And so over time, what we found is that most people are going to be part of that 80% in most years. Okay, where most people are just a small claim filer in most years, but are likely to be a high claim filer at some point. Okay, and typically that's about once every 3 to 5 years on average. So the design of the HMA also is built to be a very cost-effective way to manage claims risk based on how medical expenses naturally occur. Smaller expenses in most years, where most people aren't going to have a need to use their HMA. They can take advantage of the higher crediting that we award and build up a much higher account balance than what they paid in, then use that to offset and pay for their future expenses, future high expenses, that typically only happen once every 3 to 5 years on average. Then as a user account, it's going to move them back down this 35-month schedule. Then they just reset according to what month they fall to. We'll start building back up from there. So it's going to be an ongoing benefit, something that they can build up over time and then use it when they need to, and then build it back up and use it, build it back up and use it, and so on. Okay, but the key here is that it's designed to cover deductibles and other out-of-pocket expenses based on how claims naturally occur for most people. Smaller claims in most years, higher claims only about once every 3 to 5 years on average. Okay. All right. Now, our members are able to use their account at any time. Okay, obviously there's an incentive not to use it early on because they would want to build up into the higher crediting values, build up that benefit. Okay, so there's, again, kind of, not only a built-in waiting period, but also an incentive for our members to kind of not use it in the beginning and wait till it actually builds up into the higher balances. Okay. Now, the way our members use their account is simple. It's through a prepaid Visa debit card that is issued and FDIC insured through Bancorp Bank. That gets mailed out to them as soon as they enroll. They'll activate it just like any other Visa debit card. And now it has their balance loaded onto that card. So anytime they want to use their HMA to pay for an out-of-pocket medical expense, they just use that prepaid debit card. Okay, they can swipe it right at the point of service, like if they're checking out at the dentist or the doctor. They can use that at the pharmacy, pick up prescriptions. If they have a major claim, they're in the hospital, and they get the bill 60 days later, they can use that card to pay that provider online or over the phone, okay, when they get bills in the mail. Again, it's used just like any other debit card. Okay, however, a key to using a risk-pooling strategy and being able to award this crediting based on claims experience is that there is no non-medical use. Okay, so at no point can they use this like a regular savings account and just decide to take out money or pour the money back out or build up and use it to go on vacation or buy a new car or anything like that. Okay, so the way we monitor that is our prepaid Visa debit cards are programmed based on Visa's merchant category codes to only work at qualified medical providers. Okay, so again, use it at the doctor, the dentist, the hospital, chiropractor, pharmacy, all that's fine. But, you try to go on vacation, buy plane tickets, go on a cruise, buy big screen TV, anything non-medical will automatically get declined at the point of sale. Okay. Now that does, obviously, like I mentioned, that's very easy and convenient to use. It's like, medical benefits on the go. All you got to do is take your debit card with you. Okay, so it's very easy, very convenient. But it also gives our members complete control over how they want to use their accounts. So like I mentioned, and as you can clearly see here with the way our benefit accumulates, is there's an incentive not to use it early on. Okay, because every time they use it, there is an opportunity cost. Because we subtract however much they spend, which reduces their balance and moves them back down this 35-month schedule. Okay, so this 35-month schedule is going to fluctuate. And the way you want to think of this is every month the account's not used, they're moving up. Then whenever whenever they do use it, they're going to move down. And they can start moving back up, and then they use it again, they're going to move back down. So there's an incentive to be careful on how you use this. If you overutilize it, if you start using it in the beginning and you start using it every single month, it's like you're taking one step forward and one step back. And so you're never going to build up into those higher benefits. Okay. So, let's say in month 2 here, let's say this is my account. And I paid my $140 for 2 months. I paid in $280 and I have a $230 balance. And then I have to go pick up a $30 prescription. For me, I'm not using my HMA to cover a $30 prescription, especially in the beginning, because that's going to set me back along this 35-month schedule. So I want to use this for every little nickel and dime expense I'm going to have. Okay? Now, once I start building up into years 2 and 3, then I can start using it a little bit more often because I'm already at a high account balance. I've already got the extra crediting built up, and that's not going to, really hurt my growth. But when you use it early on, it does set you back about a month each time. So again, it gives people complete control over how they want to use their account. It really creates, some savvy health consumers on how they want to actually, utilize and pay for their medical benefits. Okay, but all these go into, again, creating, the HMA, which is now, again, as you can see, the premier first-dollar benefit on the market. Because there's so many different ways that this can be, marketed and sold to your clients. Okay. The first thing, if you work with those under 65, the main thing everyone's worried about is their high deductibles. Because, of course, most people are going towards high deductible plans because of the cost of premiums. Most people do not want to pay the additional premiums to buy down that deductible. They don't want to pay for, a platinum or gold level type of plan. So, of course, most people are moving up to the bronze level plans because most people know they're likely to just be healthy in most years anyway. So why overpay for health insurance? So now you go back and show them, well, yeah, hey, let's go take that bronze level plan. Let's find the least expensive premium we can because, right, you are healthy. And basically this is just becoming a catastrophic plan now. But now we need to do something about this first dollar benefit. How we're going to cover this deductible. And you can show them the HMA is going to be the most valuable way to fill in that gap. Okay? They're just going to have to make a relatively small monthly contribution to build up a significant medical benefit to cover that deductible. Okay? Now, something else you could do with those that are under 65 is, kind of plan out, is there anything they're expecting to need or to happen over the next 3 to 5 years? Okay, one thing me and my wife did is use it to cover the cost of her pregnancy and childbirth. Okay, this actually came out on the market in 2016. I was part of that launch here with the company. So we got it in July of 2016. At that point, I was dating my now wife. A few months later, we got engaged. A year later, we got married. Added my wife onto the plan. And we'd used it a few times over that first year and a half. But shortly after we got married, we really started talking about, okay, when do we want to try for kids? And then once we made up our minds, then, we focused on building up the HMA specifically to help cover the cost of pregnancy and childbirth. And now we actually just had our first child about 4 months ago. So that depleted our account balance down. We paying the doctor bills, hospital bills, all that stuff, depleted our account. But now we're going to build it back up because right now, the thought is that we're going to try for another child in probably a year and a half or 2 years. So we want to build up our benefit back up so we can use it to pay for our next pregnancy and childbirth. So that's how we're using it to plan out for expected expenses. For other people I've talked to, it's a great way to save up for braces. If they have young children and can foresee needing braces in the future, great way to save up for braces. Maybe they want LASIK eye surgery. Maybe there's, a hip or knee replacement or shoulder surgery, some, inpatient or outpatient procedure that they can, kind of expect over the next few years. Could be major dental. Could be an elective procedure. Okay, so again, not only is it great just to show them, hey, you have this deductible, let's cover it, but let's also talk about what types of expenses, what types of events can happen over the next 3 to 5 years. And when you take that approach, you'll find a need for this for most people. Same thing in the senior market. If you sell Medicare, whether it's Medicare Advantage or Medicare supplements, again, there's always out-of-pocket expenses. And this works great alongside a Medicare Advantage. Again, similar process to selling this alongside of a high-deductible health insurance plan. Okay, you show them, hey, take the lower premium with the Medicare Advantage. Yes, it comes with more out-of-pocket risk, but let's fund that risk with the HMA. Okay, so you're basically pairing up the HMA with the Medicare Advantage. Okay, even if you are selling supplements, same thing. There's always going to be out-of-pocket expenses, especially things like dental, vision, hearing, elective procedures, prescription drug costs in the future. So again, you always want to say, okay, what could you need this over the next few years? What are some of the things that could come up over the next few years where you would really need this? And again, when you take that ongoing approach, that kind of puts it in perspective for people. Because over time, because of how comprehensive the HMA is, there's a very high chance they're going to need this at some point over the next few years. Okay. All right. So again, like I said, what we want to talk about today is just to introduce you to our HMA product. Again, it stands for Health Matching Account. Okay. So we looked at how it works. We looked at the benefits that we provide. And then also just got done talking about different ways to actually market and present this to your clients. Okay. Now, one last thing is everyone always asks me, well, who's the primary target market for this? And really the answer is everyone, for the reasons I just stated. There's no restrictions on who can enroll. Everyone has some form of out-of-pocket expenses.
Unmuted.
I have 11 different options here. So it really can fit in with anybody's medical needs and with anyone's budget.
Can I ask you a question?
Yeah, absolutely.
Okay, so does this pay for any premiums of any policies?
It does not. I did briefly mention that earlier. Really, the two medical expense categories that are not covered are paying for premiums and purchasing over-the-counter products.
Okay, and is there a brokerage program? In other words, I'm a super broker where I bring in other agents, and they're selling this product because I introduced it to them. Do you have some kind of tiered commission program like that?
We do, yeah, absolutely. And I'm about to get into the commission now because I got a few minutes left here. So we do pay commission. You would have to get appointed with us. We do have a contracting process similar to getting appointed with an insurance company. I'm gonna be sending those instructions out on how you get contracted with us in the recap email that I'll be sending out shortly after our call. And the commission, it starts our street level, pays out
Before you say that, I want to say one more thing about the premiums. Long-term care was mentioned on your video, and I mistakened it for making those premiums for long-term care. So obviously there's expenses with long-term care. How does that play into this?
Yeah, so it'll cover long-term care expenses, not premiums. So, whatever, if they're in a nursing facility, what's the monthly cost? $6,000, $7,000 a month, whatever it is. They can use this towards paying for the actual, nursing care costs. Or if they pay for a nurse to come over 8 hours a day at $30 an hour, $240 a day, can use the HMA to cover those expenses.
Okay, so what I saw you explain, there's a mathematical benefit to, let's say, for example, there's some kind of expense that hovers around $750 a month, okay? And your account is all paid up to $60,000. You're at $60,000, and all of a sudden now you have these expenses that are about $725. If you're making your premium of $725 for the HMA 60,000, and you're also having to pay a $750 amount, then that would make sense because you're getting the maximum contribution because you're in that top last 12 months of your 35-month contract. In other words, you're past the 24-month savings. So you're up there near the top. So now you're getting really, by the looks of your chart, that's almost 30-70. In other words, this program is matching so much money at that high spot up there. Let's say your savings is 60 grand, and all of a sudden you start getting these expenses, And so it knocks it down $750. Let's just match the premium, $725. So it knocks it down $725, but you make a premium of $725 to put it back up. Well, according to what I saw here, look at that. I mean, it's that basically you're putting in $725. I mean, you don't even have to put that much in to max it out real quickly, because by
no, you wouldn't, because in month 35. Let me just calculate real quick here on the side. I'm just trying to give you an idea of how much the account actually grows. If we're talking about the 60,000.
Yeah.
In month 35, when they pay $725 in, the account grows by $2,940. So they're getting about a 4-to-1 benefit, or close to a 4-to-1 benefit in month 35.
Okay, so let me jump in there. So let's say 2,000.
Now, hold on. I only got a few minutes left, so let me start wrapping this up.
Okay.
Now, what I want to mention is that I won't be able to answer everyone's questions right now. I just simply don't have the time. That's not exactly how this is set up.
Muted.
So, Carl, I do appreciate it. I'm going to need to put you back on mute. When I send out the recap email, you can go ahead and reply back with some other questions that you can think of, but I do need to start wrapping this up. So let's talk about commission. I already talked about you do need to get appointed with us. For street level, our commission rate in the first year is 35% of the monthly contribution amount, and that gets paid out as earned every month. So to put that into real dollars, it's a $14 a month commission on the $2,500, $30 on the $5,000, about $40 on the $7,500, $49 a month on the $10,000, $69 a month on the $15,000, all the way up to about $253 a month on the $60,000 plan. Okay. And then in years 2 through 5, we continue to pay a trail commission of 7%. So looking at this benefit, again, you can add it on to any other products you're already selling. Because again, your clients are always going to have out-of-pocket expenses in the future, both planned and unplanned. So the HMA is a great way to add on to whatever you're already selling, provide your clients with a premier first dollar benefit, and also make an extra commission for yourself. And then, Carl, yes, we do have a hierarchy structure. Okay, this is our street level. We do have levels above that you would have to build up to, but they are available. Okay, so I got a heart out here in about 1 more minute. So again, I just want to say thank you to everyone who was able to come on and take time out of your day to join me. Again, the next step, I'm going to be sending out that recap email where you can use that to review some of this information. If you're interested, you can complete the contracting process. I'll have the instructions attached through our broker contracting manual on that email. Then once you do complete contracting and once you're issued your writing number, we will invite you onto a sales training webinar as well. We do those every day. They're only for those brokers that are actually contracted with us, because at that point we're going to go into more detail about this. So really, like I just mentioned, on month 35, on the $60,000, when $725 is paid in, the account grows by $2,940. So we actually provide you with a month-by-month schedule on how this works. That's not something we give out now, because you do have to be appointed with us to have access to that formula. All right, but again, everyone, appreciate your time. And again, any other questions, feel free to reply back to the email I'm going to send out, or you can try to call into the office. You can try to ask for me. I know, again, I have other calls, that's why I have to run. But if I'm not available, you can ask to speak with one of our other representatives, or send me an email and I'll respond to it when I get a chance. All right, so again, everyone, thank you for your time, and I hope you have a great rest of your day. Bye-bye.
Unmuted.
Thank you.